The key players in Addison's disease are the adrenal cortex and steroid hormones, aldosterone and cortisol. Aldosterone regulates your blood pressure, retains sodium, and secretes potassium. And cortisol is your stress hormone. So it helps your body deal with stress, increases blood sugar, breaks down fats, proteins, and regulates your electrolytes. So with Addison's disease, your adrenal cortex that releases these hormones, there is basically a disruption in your negative feedback loop. So this right here is the negative feedback loop system. So how this works is your hypothalamus releases CRH hormone, which is the corticotropin hormone. Once this is released, your pituitary gland then gets the signal and releases HCTH, which is adrenal corticotropic hormone, which then causes the adrenal cortex to release cortisol. So Addison's disease is basically a malfunction in this system.
Sierra is feeling the following symptoms: severe weakness, confusion, pain in lower back, severe abdominal pain, vomiting, and diarrhea. According to her symptoms, what do you think is going on with Sierra? Sierra is experiencing Addisonian crisis slash adrenal crisis. Addisonian crisis refers to an acute status of severe cortisol and aldosterone deficiency. When you're stressed, your adrenal glands, which sit on top of the kidneys, produce a hormone called cortisol. Cortisol helps your body respond effectively to stress. It also plays a role in bone health, immune system response, and the metabolism of food. Your body normally balances the amount of cortisol produced. An Addisonian crisis can be extremely dangerous if cortisol levels aren't replenished. It's a life-threatening condition that requires immediate medical treatment.
Sierra is on her way to the hospital to confirm if she's suffering from Addison disease. The diagnostic tests that are used for the diagnosis of Addison disease includes a blood test, and the blood test will measure the body's sodium, potassium, cortisol, and ACTH levels. Low sodium with high potassium or low cortisol and high ACTH levels indicate Addison disease. Second, we have the ACTH stimulation test. This will evaluate if your adrenal glands are working well by how they respond to ACTH hormones. And third, a CT scan. The healthcare provider can take a look at the adrenal glands using an abdominal CT scan, which helps detect any changes in the adrenal gland. And lastly, insulin-induced hypoglycemia test, and this will help determine how the adrenal glands respond to stress.